thank you so much for coming this afternoon. Yeah, I really appreciate you guys coming. It's a small, close-knit group, which is wonderful. We do have some people that unfortunately can't make it today in person, so I will be doing a recording and I'll forward you the link as well afterwards so you can review it in your own time. So as you all are aware, we are doing a training next hour and a half on peer support groups. So thank you so much. Alright, so just a quick run through of what we will be doing today. So firstly, I'd like to just make sure we're all on board so we all understand what is the purpose of the support group that Caring Together Ministry is holding and how it all looks like within the context of cross-culture. We'll then be looking at guidelines and group rules to make sure the support groups run smoothly and respectfully. Then we'll explore a little bit about roles and responsibilities from a facilitator's point of view and then from a participant's point of view. Then we'll go into looking at handling conflict, because undoubtedly there will be some sort of conflict or disagreement throughout your experience as a facilitator, because we are dealing with very sensitive issues and there'll be differences of opinions. So if you're ready for that, you'll feel a lot more calm, cool and collected when you have to deal with that. Finally, we'll look at a couple of case scenarios so we feel a bit more equipped in handling these situations should they occur. Okay, so hopefully by the end of today's training session, everyone will leave here with a greater understanding of the role and the function of support groups. Hopefully you'll come out understanding the role of facilitators in a Christian context. You'll learn how to facilitate in a Christ-like manner. A greater understanding of how support groups fit within cross-culture. And lastly, as I mentioned before, hopefully you'll feel a little bit more equipped in handling conflict. Okay, so just so that we are all aware of how this looks like from the bigger picture, I'm sure you all know Cross Culture's vision statement, which is know Christ, grow in Christ and proclaim Christ. So just to start it off, I'd like to ask, how do you guys know Christ in your own personal way? You can just shout it out. I might start off. So for me, I find that attending cell group and liaising with friends and family and praying together with them, that's how I sort of know Christ and learn more about him in my way. So that's sort of my personal way. Any other? Just feel free to shout it out.
My point, when I was a teenager, nobody, like when I was 9, nobody went to church. Oh. Okay, when I was 9 years old, like I was searching for God, and nobody, like even in my school, my friend is a Christian, but she never invited me to a church because they find like it's a religion, and they never urged to me like their group, and but I know she's a Christian. Finally, when I was 16, only then one of my classmates, she invited me to an Easter camp, and that's where I felt God's, during the prayer time, I felt God touch me, and during the worship or preaching time, I felt God's love, and from then I accepted Christ. So it's true, a friend invited me to a camp. Yeah, so if I would know when I was like 9 to 16, like 7 years? Roughly like that. Like if I knew God 9 years old, I said, damn, So, but anyway, it's not too late. I'm here, so thank God.
Excellent.
Yeah.
Thanks for sharing. Great. Anybody else have any? That's okay. Yeah, I just the exercise was just really to highlight we all know God and experience Him in different ways. So some people, through praying, reading the Bible, through attending different events like church camps, cell groups. We all know Christ differently in our own personal styles. So just like the support group here, we are under the category of knowing Christ, and the support group aims to really provide an opportunity for participants to experience Christ's love through a safe space for people to share and support each other. So sure. So it's really important that we understand this so that we know the aim of why we're doing this group, and we can more accurately align our values and our skill sets to serving the people who attend. All right. So I'm sure that people who might already be working in the health industry might understand and recognise that support groups are actually a very important and a vital step in helping recovery of different people. So I'm just going to have a quick run through of the different modalities of support groups and why support groups are necessary in supporting people. So firstly, support groups can involve skills development. So for example, just say you're working in a domestic violence centre and your clients have a lot of anger issues. So the perpetrators of the clients might be experiencing a lot of behavioural issues such as anger. So running a support group that focuses on a skill development, such as teaching somebody how to control their emotions, will be very, very useful in this case. A second reason why support groups exist are for psychoeducational topics, psychoeducational purposes. So for example, if you're working in a drug or alcohol centre and you're dealing with people who are, working through their addiction journey, having a support group which focuses on substance abuse will really help the participants understand their harmful addictive behaviours and the harm that substance abuse is having on their own life and on their loved ones around them. So in that context, a psychoeducational support group will be really, really useful. Support groups are also very valuable in providing cognitive behavioural therapy or support in that way. So for example, if you own a private practice and a lot of your clients come to you and they have anxiety disorder, having a support group which aims to provide skills in altering their thought pattern will really help them deal with their anxious thoughts and behaviours. So that's another example of when this will be useful. A fourth reason is, and this is where our Caring Together support group falls under, which is having a platform for people to share and support and encourage each other. So really just having an area where people can really share their thoughts, share their life challenges, mental health challenges, and grow and be heard that way. And finally, another reason why support groups are really, really important is for the purposes of interpersonal process groups. So this aims at really getting to the underlying reasons of why some people might find it really hard to recover in their addictive behaviours or whatever issues that they're trying to work on, and really gets down to that bottom underlying driver. So as you can see, support groups are always used in the context of vocational work or in a church context, like we are here. So hopefully that gives you a little bit of an overview of why support groups are so valid and important today. So now that we have this broad understanding, we'll zoom it into peer support groups at Cross Culture. As I mentioned before, the aim and the reason why support groups were started was to really provide a voice and a place for people who might be, having a hard time, be able to connect with others, and be really open and honest in sharing issues that they might be struggling with. We hope that through here people can find hope and encouragement, and therefore feel empowered to make change from here. It also can be a place where participants receive recommendations for other mental health referral recommendations to, Christian pastors or books or different mental health clinicians if they would like. And finally, the most important aspect is we really hope that this will be an area where people can experience God's love through the kindness and through the compassionate encouragement of those within the groups. So now, how does a support group actually run smoothly and well? Well, that is ensuring that guidelines or group rules are implemented, and there's a set of guidelines. So I just wanted to make a note that at the start of every support group that you will facilitate, guidelines need to be stipulated, just because there could be newcomers coming different months. So it's very important that guidelines and group rules are said at the start of every session. So this might seem like a lot, but it's probably quite intuitive and innate to all of your own personal behaviour anyway. So just to have a run through, the group rules are, the support group are always to be a safe and comfortable environment for everybody. Because it is peer-led, members can suggest different topics to discuss and focus on. Meetings are to start on time, and if people do run late, the onus is on them to sort of catch up on what has been said. Members are to take it in turns to speak and speak respectfully. Of course, comments and different opinions can be voiced, but it's important that everybody takes it in turn, and if you do have a difference of opinion, just to voice it out respectfully. Periodically, guest speakers can be asked and to speak in the group if that's desired. Now, obviously, aggressive and violent behaviour will not be tolerated, and if this does occur, that person will be asked to leave the group. Discussions are to be kept confidential unless it's stated otherwise. And last of all, just be open-minded. Because we are dealing with different sensitive mental health topics or people discussing their life challenges, everybody's going to have their own different experience and different thoughts and feelings about things. So it's important to just be open-minded and accepting of what people say. Alright, so how does this actually look as facilitators for you guys? So before I launch into this, I just wanted to highlight, because I did have a few people come to me during the week saying, I'm not sure if I know what to say, or I'm qualified enough. And I just wanted to let you know that it's okay, and to hopefully provide some comfort, because our role as a facilitator is not to make any mental health diagnosis or give recommendations on the treatment or the drug, although you might have background in pharmacy, which is wonderful to help as well, but that's not our main role. And if you go back to the couple of slides before, when I was talking about what is the vision of this support group, and the main aim is to provide support and encouragement, well then hopefully you'll be able to feel more at ease, because our role, not diagnosis, that's a psychiatrist's role. So our role is, if we look through this diagram here, so first of all, we come in, we open up the meeting. We set the tone for this discussion during the time of the meeting, and we make sure that the support group sticks to the agenda and the time. We help members to share and listen to each other respectfully. And when problems arise, we are the mediators and we are the ones that participants will go to help sort of resolve such a conflict. And finally, we close the meeting in a timely manner. So I'll go through exactly the nitty-gritties of how this looks, but from a broad perspective, this is your role. So feel free to stop me if you've got any questions along the way. Okay, so I thought as we continue on, it might be worth while to look at what the Bible says of the qualities of a facilitator. Does anyone want to volunteer reading what's in the purple box?
Yeah.
Yep.
We are all called by God to be His instrument of change in our lives. What does being instruments of change mean?
Thank you. So before we read the other boxes, maybe just have a think. What does instrument of change in others' lives mean to you? Even when you just read or think about it in a non-biblical context.
Can you replace instrument as vessel or not? Because I know that Christian is a vessel, God uses us as a vessel.
Yeah,
So I'm not sure here.
Yeah. That's a really good point. The vessel of change in others' lives. Any other ideas or thoughts? Well, how about we go and have a read of the different verses. I just
Honestly, I would say it's good to develop interpersonal skill, listening skill. Yeah, you see, listening to that person. Let's say you have clients in front of you. Yeah. Although it's against your Christian, doctrine that she has done something that ending up, it's never to judge them. But even when you don't know how to say something, by standing next to that person, your spirituality stands out. Because I remember my own supervisor had discussed this thing with me, and also my paper when I had to write 7,000 words. That was what happened. And then the prayer thing is that this is substantiated by a study in America. People who are saved, doesn't matter which faith they come, they're Christian or Muslim or Hindu or whatever, they all feel that if the healthcare worker pray for them, it actually help them to recover quicker. I know that it's exactly like that. So in a Christian community, how much more when you already know some people in your church that they already say, they have this, they have that, but it's okay if we don't feel that we are confident enough to pray. So I think at a personal level, sometimes even my own problem, I never pray. I have to say, possibly it can benefit me also in that share prayer, the kind of
Thank you. Yeah, no, that's great reflection, and thanks for sharing your experience as well. So maybe we might have people read what's in each box to help us understand from a biblical point of view as well. And I just wanted to let you know that these verses, some of them are sort of paraphrased because there were more than one verse in, but I was trying to get the point across. So if we can, maybe each person just want to read.
2 Corinthians chapter 1, verses 3 to 11, showing the love of Christ by sharing in all struggle and expanding God's grace as we come.
not being judgmental of people who are different from us. Asking good questions and interpreting them in a biblical way to provide sound advice. Yeah, we got to attain a little bit higher the status in order to do that.
Yes.
speaking the truth in love from Ephesians 4:15.
Offering accountability and reminding people of their identity in Christ, sharing each other's burdens. Galatians 6 verse 2, Philippians 2 1 4, and 2 Peter 1 3 to 9. Wow, that's good.
Thank you. So yeah, as you can see, there's obviously this list is not be all end all. There's a lot of other verses that can be applied here, but yeah, so you can see, there's an underlying theme that we are to really journey alongside people in their struggles, just like Jesus did. He went and he was a companion to a lot of people who were struggling. And he did not judge them, he loved them, and he supported them through his compassion and care. And if we want to reflect that as well, especially within this ministry, we are well positioned to do so. So hopefully that provides some biblical context of what the Bible says how we can act as facilitators. So now, having read that, we can sort of translate this into a practical way and translate these verses into how this will actually pan out when we do when we facilitate as support facilitators. So I'll just read what's in there. So, we can be approachable and welcoming, we can be open to change, understand everybody's different and have different opinions, have empathy and compassion, respect all members equally, have personal insight into own life experience, values and beliefs, be able to deal with conflict calmly and patiently, knowing that some days might work and some days don't, and act upon feedback from members. So hopefully that, these are some qualities that we can try to work towards or try and instill in ourselves to ensure that we can be confident and sort of well-versed facilitators. Okay, so you might be wondering, what exactly do I need to do when the support group actually runs? So here we go. So this is from start all the way to beginning. So yeah, hopefully it provides you with some level of confidence. So how it's going to pan out is I will have a roster and we'll have 2 facilitators on every month. You wouldn't need to be facilitating on a monthly basis, but I know on your sign-up forms you've put in your availability, so thank you for that. I will send out a link over the coming months, and if you can't make a certain week, please just let me know and we can sort of rearrange and reshuffle. So on the day that you are rostered, I would suggest in the morning, pray to God and just ask God, please give me strength and guidance on, running the support group. And if you were here this morning, Pastor Sandy, it's not like our doing. It's God that He will guide us and He will help us in running the session. So obviously go over the notes on the topic of discussion, and at the heart of all things, try and ask God to remind you that everybody's made in God's image, and even if you might not fully get along with somebody or might not agree with somebody's views, that's totally okay because they are loved and made by God. So support groups are to start at 12:30, so please arrive 20-30 minutes earlier to set up the room. We aim to have a circular format, and there will be sticker labels, so it's quite helpful so everybody can put their names and stick it on so that everybody is aware of everybody's names. And I do ask that for the facilitators in charge for that week, if they could be responsible for getting some snacks or some chips. Hopefully we won't have to spend more than $5, but if you need reimbursement, please come and let me know. And then yes, please provide some pens and paper so participants can take notes as well, and for minute taking, which I'll get to a little bit later. So as people start entering the room, it would be great if you could make eye contact with them and greet everybody as they come in. Ask them to sign in with their name and email address so we can record the attendance. And within 5 minutes of it being 12:30, you can just let people know we're going to start in 5 minutes time, and to make sure it's punctual, don't wait for if one person's running late, because it just drags the whole thing. So just start and people can just catch up later on. A simple let's get started is enough to get the ball rolling. Yep.
Just a question for the participants. Are they, for participants, is it just anyone, is it like a member of the public or someone from church that's expressing interest in joining? Just because when you say like aggressive or like...
Yes, yeah.
Probably most church people are going to be like...
Yes, so I just have to put a caveat because I often work in a public mental health where there is quite common for aggression, but in this context, you'd think it'll be less aggressive, but you never know, because if someone does have maybe a mental disorder and something does trigger them, they could, and it might not be aggressive in violence, it could be even just yelling, and it might be like, ooh. So for the time being, the support groups is open to members of cross culture, and I'm not sure if you heard a couple of weeks ago I spoke in the morning, and I had a sign up form similar to the one you would have signed up for here. You can also sign up as a participant, so there'll be a link as well at the end of this seminar that you can forward to people that that might want to join. But at the moment, in short, to answer your question, it will be targeted at people from cross culture. Okay, so just say everybody's here in the room, so you want to open the meeting. As I mentioned earlier, it's very important that we stipulate the guidelines or the group rules at the start of each session. So you don't need to spend, more than a couple minutes. So just quickly run through them so that participants and facilitators know expectations to themselves, to others, and to the facilitators. It's very important that you highlight that discussions will be kept confidential, and that's to ensure people feel safe to share. It's a wonderful way to get everybody to introduce themselves, so people can just get to know who's in the group, what their background is. Now, to ensure that people feel empowered and they do have responsibility, it's wonderful if a participant can volunteer to take minutes. So at the start, if you could ask for a volunteer to do that, that is a great way as well to run the session. And then you can just sort of start off by touching on a topic that someone might have discussed during as they were coming in, or you can raise an open-ended question. So throughout the whole peer support group, facilitators are to be involved in active listening. So these are some of the ways how this looks like. So it's really listening and hearing and understanding what somebody is saying. And that can be reflected through the body language.
Sorry, I just want to know what's the open-ended question?
Oh, yes.
Yes.
So I will, in the next slide, I'll go into a little bit of that. But basically, it's not having a yes or no as an answer. Yeah. But that's a great question, and I'll touch that in the next slide. So that's so as I was saying, active listening, so through someone's body language, making sure that you're looking at the person talking, not just looking out there or on your phone or something like that, just to make sure that you're showing, okay, you're really engaged in what that person has to say. And you can also make brief statements such as yes or okay, sure. That's also very helpful as well. or you could be nodding when somebody's talking. So I'm sure you probably all do that anyway in your own, at work or with your friends. But yeah, just a reminder. Throughout the session, we hope to continually encourage members to make sure that the atmosphere is comfortable for people to talk about personal issues and experiences. Yeah, just want you all to be mindful that, yeah, people who are talking about, something that's happened to them in the past, it is a time of vulnerability for them. So just be respectful and conscious of how others might be feeling. You might find that to gain trust, facilitators might have to share something about their own lives, just to make the other person, know that, we're all on the same level, and this person, even though they're a facilitator, they've also know what hardship might look like. So maybe before the session, when you're doing your planning, just have a think about something that you might be okay with sharing. Okay, so to keep the facilitation running smoothly, it's very helpful to ask open-ended questions. So thanks for that. So, phrases or questions such as like why or how or tell me about something really encourages the member to answer more holistically, and it's not just yes or no as their answer, so they can answer more meaningful. So I'm sure you might all do that anyway, but that's a great way to encourage people to talk more and explore more on the issue. I do want to highlight that it's okay if there's silence or nobody's talking in a group, because as I said, it probably is sensitive issues that might come up throughout the session, and it's okay to have silence or just be reflective. So don't be afraid of that, because I do know I used to be like, we always have to have somebody talking or something like that, but in this context it's totally okay and it might be helpful as well. But as facilitators, I'm sure you'll be able to sort of suss it out and go with the flow of the peer support group.
Sorry, Serena, I just want to know, what topic are we talking about when you say is it a working people group or a university group? What kind of people are we having?
Yeah, so because I've opened it up to people in cross culture, they come from different backgrounds.
Right, yeah.
So there are a few people that signed up that are working, and sort of maybe in their 20s, so in university at the moment. Yeah, so there will be a mix, drawing from different backgrounds.
So this peer support group training is like supporting each other, like encouraging each other, is that right? Or
Yes.
in their daily lives or in their struggle lives?
So the focus point will be different for each month. So for example, the first month where we'll be having it in April will be focused on loneliness. So every month there will be a common theme.
Oh, that's great. Yeah.
Yeah.
That one. Yeah.
And people who come doesn't matter what background, but they might have some connection to loneliness
that's
in
great,
that
yeah.
way. Yeah.
That's good.
And then the next month we might have something different.
Yeah.
But I mentioned before, this is a peer-led support group, which means we don't always have to think of the topics. If participants have suggestions, they're more than welcome to let the team know, and because we want to be guided by what's relevant and helpful to them, not just we make up everything.
Yeah. Great. Thanks.
Can I ask a question?
Yeah.
Before the participant want to engage in this peer support, how do they know and who should they contact? Like one had loneliness, one may have English language problem.
Yeah.
Wanted or settling problem. Another one could be a refugee.
Yeah.
Or that kind of thing.
Yeah.
Need to write a resume or something
Oh.
to get a part-time job.
Yeah.
Have to help themselves being a prophecy student.
Mm.
Like that. Then how do we know which what background or what in what context?
Yeah, that's a really great question, and that's what I love about this support group, because as you can see, even from your question, the need is so big and varied, and that's why for now we've decided to start it monthly, and each month we're thinking of focusing on a different topic each month to be able to cover different needs of people from the church. But over the next coming weeks, Caring Together Ministry can promote this so that listeners in the congregation are aware that if they do want to provide suggestions, they can email the Caring Together support group or myself, or hopefully they'll recognise my face and just come up to me or anybody in the team and provide suggestions. And yourselves, even as facilitators, you can talk to them and they can give suggestions to you and you relay it back to the team. So there can be different methods to do that. Yeah. Okay, so we're up to offering support. So that is the main reason why this group exists. So really, if just say you're really nervous on the day, or you're like, oh no man, it's not working out, all you have to think is, okay, what is the aim of why we're here? And the aim is we're here to allow people to really voice their thoughts and their feelings, and we're here to support and provide hope. And if people can just feel listened to, the great revelation coming in from that is they feel heard and empowered. And when they feel heard and empowered, then they have a higher personal motivation to make change in their life, and making change in their lives leads to fulfillment of their own personal goals. So it's all sort of a cyclical pattern. So if everything you're feeling a bit nervous, just remember the aim and the vision of the support group, and hopefully that will ground you back into why we're doing it, and you can feel calmer as a result. Now, support groups, obviously can offer recommendations to Christian mental health clinicians, websites, books and pastors if needed. And I wanted to have a little folder ready for everyone today, but unfortunately I didn't find the chance to fully finish that. So over the next couple of weeks before it actually starts, I might find you personally and give you that folder, or I'll put it in a pigeonhole and then you can come and collect it. But it's sort of just like it's going to have information about different topics, such as anxiety or anything, just so you're familiar as well. And I'll have some referrals and recommendations to websites and clinicians. Finally, we'll closing up the meeting. So the meeting is to last 1.5 hours, and we really want to make sure that we don't go past that. Otherwise, people just become, a bit fatigued, and even really emotional. So to wrap things up, you can make a summary statement. So maybe just have a quick sentence or two to wrap up what we've discussed during the session today. You can ask for any additional comments or questions, and then ask for volunteers for the next meeting. So to help set up or clean up or take minutes. And this allows for participants to take ownership in the group. And you can thank people for coming and end with a short prayer. And then after the meeting, you can just review the notes that you've had and make final clarifications. If you can grab the minutes off the person who wrote it, and then circulate it to the group members during the week, just so everybody has a copy and they can remember what's happened. Now, so we've gone through, the roles and responsibilities of a facilitator, and equally as important, we need to understand from a participant's point of view how they are to act and be involved as well. because they obviously make up the other half of the group. So, as I mentioned a bit earlier in the session, we need to make sure that all the group participants are aware of the rules and expectations, so they know how to sort of liaise to each other and to the facilitator. Participants are to be aware that the group is to be a safe and non-judgmental environment, and inappropriate or aggressive behaviour is not to be tolerated, and if that happens, they will be asked to leave the room. We want participants to understand confidentiality, and not to go out and share whatever they've talked about to their neighbour that evening. We want them to know that they're very encouraged to help take minutes to listen, support and encourage each other. We really want active participation from participants to ask questions to each other and not to be afraid to steer the support group. Like, the facilitators don't need to always be the one asking the open-ended questions or leading it from point to point. The meaning of peer-led is you lead each other, so they can be the ones asking questions, providing encouragement and coping mechanisms. And participants are allowed to connect sort of outside of the peer support group, so there's no sort of like, you can't talk to each other after you leave the room, so so that's okay as well. Okay, yes?
Let's say if a participant's not comfortable sharing something in the whole group when they want to ask maybe just you or some other participant, how do we process this or guidelines with that?
Yeah, that's a great question. So I suppose we will have 2 facilitators in every group, just so the facilitators themselves feel supported. So, there's every chance that participants are welcome to chat with the facilitators alone after the session closes. And then the facilitator can maybe draw out more information from that person as to why they might not be afraid, why they might be afraid to talk about it in public, so maybe before or after, and then just to find out a little bit more about that. But that does require you to, I guess, stay back a little bit later or whatnot. So Okay, so any other questions? Oh, yeah.
Now, because this is the church is doing it, the participant of this forum, they know that this program going on. Loneliness, yes, I feel lonely. I want to come 1st of April, for instance. Now, is there any kind of official, legal or ethical statement or whatever that they have to sign to give us the authority to advise them? Can be just simple thing, as I say, that if it's a new student, an immigrant or student, want to do equal whatever, is there anything like that? Because they cover the church as well. Because we do not know what is their main problem.
Yes.
It can be someone who is an Australian citizen who has been in church for a long time, or he just come to Christ or whatever, and right. And then sometimes maybe due to lack of experience, let's say, any of the facilitators. Have you thought how do we deal with those things? For instance, they can say, she told me to the helpline
Yes.
or whatever to ring and all that.
Yes, that's a really, really great question. So there will be like an agreement form that that participants, before they come in, they will have to sign, and they'll have caveats like that. And as I mentioned before, we aren't providing advice, like legal advice as well. Yes, that sort of goes beyond what we're capable to do, because also we're not we're not like all
Yeah, like you said, we are not
qualified as
we are
a
not
certain
diagnosing
profession.
their condition.
That's right. Yes, we're here to. So going back to the aim of what is the aim of this support? Well, we to support and provide encouragement. So that's the crux of it.
Yeah.
So, but that was a really great point. We will have a little sheet that they need to sign just to make sure that we cover ourselves as well. It's like an insurance policy
When
thing.
when they feel safe, they will automatically sort of tell us more maybe about that.
That's right.
And then there is where the experience of the facilitated kind.
Yes. Yeah.
Maybe that's also why taking the minutes is important too, because if we're taking some minutes and the facilitator suggested this, and then if that person comes back and says, this is what they told me to do, and so I think taking minutes is probably a good idea, because then we have some documentation of the things that are talked about in the group, and then if something happens in the future, we can come back to what was written down during that time. So that's good. Yeah.
Yes, so there'll always be a recording or something. So if we get audited, I suppose, we'll be able to have documentation to show, this was what was said or asked, and this was the response. Yeah.
Or you want to, what are you saying?
I think sometimes usually when we are not at a very formal or comprehensive situation where we can do a comprehensive assessment, we usually, even if we already have some of us maybe already registered professional, we'll have a disclaimer saying that this is the personal recommendation. I don't know the wording.
Yeah.
It's not. If you have further questions or anything, you please consult your GP and have something like that to.
That's a good idea. Yeah.
Furthermore, you see, we
Big page.
also know the background of all those participants.
Yes.
So this kind of thing that we are talking about, it applied to research. And I can actually record it, and then I have to play back, and then because every sometimes it can take up to half an hour. You see, that's it. That's what this is.
But yeah, thanks for those points, because that is very important, because we don't want to be like sued or anything, and we need to make sure that the church is covered in all aspects. But
Participants also know that this is not a place to come for medical consultation.
yes, that's right.
That's
So
it, and it's not for legal advice.
Yes.
How to immigrant, even though we know a lot that, how many points, but that's it.
yeah, we're not
And
law.
we have to be cautious enough to say, at the moment the immigration law say that, what is it, engineer or something, how many points and all this thing.
Yeah, that's right. So that's why here it's very important that participants know what is expected of them as well, and the capacity that they have in the support group. So if you can sort of just make that clear at the start of every session, that will be really great. And I think in time you'll get more familiar with what to say, how to say it. So now we come to tips for handling difficult situations. So I just want you to all be aware that difficult situations are very common, and not to be afraid, because if we feel more equipped, we'll be more calmer and better able to handle such situations. And I said it's very common because when we are talking about sensitive issues, it's very easy for people to come a little bit more heightened, because people's emotions are involved, and that's totally normal. So it's important for us to just have this expectation, so when we don't come in being, it's going to be so smooth, and then something happens and we're like, so just so we know that conflict is very normal in such a context. So just say you're running a group and something happens, and it could just even be like, I don't agree with you, like that is a conflict, right? So here are some sort of suggestive ways to overcome and manage a conflict. So first of all, we really need to remain calm as a facilitator. It doesn't help if we become really flustered or think that we're not going to say the right thing or we're just going to add to the drama. So just be confident in yourself, and remember you would have prayed to God and God will be helping you. So just be objective and just realize, people are very vulnerable and it's okay. So, and different opinions are to be expected. And then just remain assertive. It won't help if you agree, take one side and then you be, oh no, actually. So just remain assertive in what you think is the right way to handle it. Choose your battles. There could be different opinions voiced. So, and depending on the situation, you might need to just take a stance and roll with that. We will have a couple of examples later, so you might be able to sort of understand what that means. And then pray to God to provide you with patience and compassion, and the underlying reason we're there to support, not to enforce our opinions and our beliefs on people. We're there to support them through this journey and this probably difficult time. And lastly, you could make problem solving a group activity if in that context that allows. So you could open it up to the group and say, oh, what do you think about this? Or, what would you do in this scenario? So here are a couple of tips. And I've just got in Galatians 6:2 there, bear one another's burdens and so on for the law of Christ. So, we can practically do that.
Can I just share something? Like, I like what she said. Like, for example, if one of the people have deeper struggle, and I'll say, I can talk to you later. Is that right?
Mm-hmm.
Like, they come to see me. Like, the person say, they come see me later. We'll keep going on. Or if the person is taking too much of my time or sidetrack, do I just ask him to come back to the topic? Is that right?
Yeah. So if in that context, if they are too shy or uncomfortable to disclose as a group, then you would talk later on, just one-on-one. But if if somebody's sort of going off topic and just leading, just talking about something, you would use those active listening and those open-ended questions to try and lead the person back to what the purpose of that support group is. But I guess it's hard to there's no sort of equation to how to do it. It really depends on the people on that day and what's being said. So I think just make your own judgment call in that scenario.
Can I say too, if someone wants to talk to you afterwards, because there's two facilitators there, as much as possible, it'd be good for two of you to be there. So even if you're having that conversation and the other person's like cleaning up a bit or doing something but kind of can listen in, just I think for accountability for us and also for protection for us as well, that there's another person there.
So best like two facilitators talking to that person.
If the person just comes to me and says, oh, can I ask you more about this thing? And say if Elijah's facilitating with me that day, I might say, oh, are you comfortable for Elijah to come too? And if they say, oh, I wanted to talk to you, like, oh, that's okay. But Elijah would still, I think it's always best for the facilitators to stay in the room together until the end. So that, maybe if I feel uncomfortable for some reason, maybe I can make eyes at Elijah, he can come over. Or, he's just around. I think, especially when there are sensitive things being talked about, and because I think I liked your point that we aren't trained counsellors in that way, but we also have to be careful about the advice and the things that we say to people, and I guess ethically how we deal with things. So I think it's always good to have another person there. So I think as facilitators, always stay in the room together until you both leave, and that other person, the other facilitator, can be drawn into the conversation too. If not, they are just kind of make yourself look busy or do something, but still just be there.
Explain to assign each room or the environment, the physical environment is very important.
Yes.
Like even our group, let's say now or whatever, like that. Yeah.
Yeah. Thanks for those topics. Yeah. Okay. So, yeah, sort of to flesh out a little bit more on handling conflict. You could probably, take these steps into account. So, as I said before, take a deep breath and remain calm. Clarify the problem. And then you can talk about different alternatives. There's always different alternatives to solving something, and then make a choice on how to take the best appropriate action. And as I said, it's sometimes really great to get the whole group involved in problem solving. And then finally, offer support. That can be through maybe chatting with that person individually later on, or finding about what's triggered that person to sort of be heightened, I suppose. And it's tricky because there's sort of no it's not like a scientist like there's this rule and this happens. We're dealing with emotions and people just having very personal views or feelings about things. So hopefully in time, as we feel more and more equipped, we'll be able to handle situations better, I suppose. Okay, so I thought we've just got two sort of case studies, and like for me, these are very. It's quite common, like just because in my own personal experience, for these to happen. And I don't want you to feel like it's going to happen here, but I just wanted to put like worst case scenarios so you'll be prepared. And because of my background anyway, I do deal with people who have diagnosed mental disorders. So verbal aggression is normal-ish.
Social worker or psychologist?
Social worker working, So we have it in a public hospital as well. So it's kind of, you do see a lot of things. And then I think as you see things happen more, then you just become more afraid, I suppose. You just feel, okay, this is totally normal. And then, you're able to just be calm.
Usually in the hospital and in the public, whatever system, there's this clinical aggression. And then we all work very cooperatively. In a very worst situation, in an acute ward, I know I will be the one who will be throwing out the IMI, and then and then the other they will put them there, then they just put them down, they just give it here.
We won't be doing that.
And psychologists don't have to do that. Frankly speaking, that's why people can't believe it. You see, if there's a stereotype out there, they will say that, working in mental health, very dangerous, that. Not that I want to be hit by the times. Because I like to call them clients instead of patients. It is a way of reduction stigma against mental illness, you see. And then sometimes I know among the staff, the nurse will say, is that one social worker or the psychologist teaching us what to do?
Are you a mental health nurse?
Looking at it from a different perspective. In a clinical review, what I mean, they will be saying this sort of thing. They're 24 hours. That's why nurses, they are the largest workforce. In any kind of specialty, is 24 hours. Well, psychologists, consultant, all these, psychologists, so they work only 9 to 5. But of course, I haven't worked for a while.
We all have different roles, but all just equally important.
Just like they're looking for accommodation, we always give it to the social worker.
Right.
And the social worker, she can just tell me how much the client is going to have. Because we work so well together. Finding accommodation.
So your nurse background is?
I was,
Wonderful.
For mental health.
So, I don't know, maybe because the group is not too big, do you want to sort of just all get onto it in one group and we can just sort of discuss?
See what we should do with this.
So I'll read it out. So it's 1:30 p.m. and a support group for anxiety has started and is running smoothly. So at 2 o'clock, someone, runs into the room yelling and showing verbal aggression. So as a facilitator that's on duty that day, what would you do to de-escalate the situation? And remember, there's 2 of you guys, and I'll just put maybe the tips. Just for some recommendations. Yeah.
So no physical aggression, just yell.
Yeah,
It's common.
Or maybe just like, I
I don't want to be racist or prejudiced or what. There is this particular ethnic group that often do that.
Maybe
Yeah,
we
or I
should-
do
let's
it
not.
too.
We're just keeping it general.
Yeah.
Probably if we can try address the person first, see how the person
Yeah, probably ask what's
Going on.
yeah, can you go into what's about?
But you have to appoint some. The support group, it can be one facilitator who is experienced in anxiety management, and then there is another one there, and then with the big, we didn't know how many people would need that anxiety support at the moment. Yeah, it can be maybe 10, 5, and maybe it's at the day hospital setting, or whatever, or is it just a ward in a community where I work?
Yeah.
I don't know.
Yeah. So for this scenario, we'll pretend it's here.
Okay, right.
At Rice Hall, or Studio
Yeah.
277, where it will be held. And we'll just say 7 people. Yeah.
Oh yeah, then one of the facilities can ask is, I don't think I would be that onus on the participant to try to figure it out. I think facilitators are supposed to try. Yeah. So I would, at least if I were there, I would ask maybe it's what's going on. Maybe it's a weird issue that unrelated to the session, or maybe it doesn't matter something about that.
That person come in here yelling, will you volunteer to go and sort it out? Say, no, I will sit down.
Yeah, I'd probably just
Yeah.
I'd probably direct their attention. Like, so maybe it's what's going on.
Yeah, can someone just come up with the doors open out there? They go out there, yeah, maybe they have some conflict with their girlfriend or boyfriend, or either we can smell if they're under the influence of alcohol.
So it did say participants. I'm hoping that's
Yeah, like they purposely had to.
yeah.
So purposely, or maybe it's, maybe someone who already say coming on the 15th of April or something.
Yeah.
Yeah. But then this is it. We don't know what this person's history was like. Like out there, Shonton Street or whatever. And then they're so used to yelling. Yeah.
when they come in for a decision, do they need to sign everything at the decision first, or
We would know whether they are the first attendance or from the record we will care for it.
so what's the procedure for?
So when they sign over originally, so that liability thing, whatever you want to call it, that will just be once off. So and we'll have that on record. But each week, just signing to make sure like a roll.
So that was with other minutes of the voice for people to take.
Yeah, to write their name and their email address and something.
Oh, they need to write the name on the paper.
Yeah.
Yeah.
But my aim is to have people sign up prior, just
Yes.
so we can be aware of how many we're expecting. And in the sign up form, I do ask a little bit about their history, so hopefully we get some information about their past and why they're wanting to attend. But there obviously may be people that come up on the day it's being advertised at church. So just being open, but hopefully we'll try and cater and be as planned as possible. But yeah, you never know. It's always good to be open with them.
So now, for example, okay, you are 7 and there's 2 facilitators in this group. So the person just come in. Does the facilitator go and approach or let the person come in and talk about it? Like, do we stop the before starting conversation? Does he one of the facilitators attend to you and sit one side? And do we carry on here? That's my question.
So what would you guys do?
We are setting the can't predict people's action.
Yeah.
Who would take the role,
Yeah.
Let's say to go and like you said to see, maybe in your practice you're so used to it already, then you just feel very confident. And then there's also this aspect of whether it should be the yelling person, maybe it's a female. Yeah, should it be better than a female? Okay. And we don't know, it may be just a marital problem. And I would say I've never dealt with marital problem that much. Yeah, okay. Or there was another case, I can't remember what it is. Is that what? Yes. Just now it's going to.
It's good to think about different how they may be having I guess to very don't start anything and then very generally approach them. That's why I was asking about the question. Any registration, just a very simple step in having them focus on the task and then getting engaged.
Yeah, it's good because those participants with the two facilitators, they are discussing about something. This is a case study. Say that their anxiety is it can be that, the 5 participants, they all have, we don't know what levels of anxiety.
That's right.
Yeah, we are giving this case study, which is good for us to learn what is it expected.
So in this sort of scenario, like it would be great if one facilitator person feels confident, and it's good for the two facilitators to discuss this prior to starting. Just discuss, if this does happen, who is going to go up, or do you both feel confident in depending on the person, because it could be male or female. So one person can go, but be inside the room, like don't go out by yourself with that person. So stay in the room and just talk quietly with that person to try and resolve, and the other facilitator can continue on, so it's not disruptive. And then hopefully that person will calm down and you can join, and then.
Or maybe just finding his way. Maybe he's got a bit of a conflict on the public transport. Another one, it's because of the sharing the seat, or whatever, Because I go on public transport all the time, and there are people who come in, sometimes I know they were under drugs, or I know that they have underlying mental psychosis that they have. Because usually people with depression will not behave like that. Or the drug people who are on drugs.
I guess worst case, then let's say if someone does escalate to violence, then is it just going to be us in 2 facilities, and what kind of security, what kind of support?
Very big aspect in churches with big mega church. Yes. I noticed recently, not here. I have attended many churches I know. In that, wow, what kind of because especially America, I really don't like it. In America, church, every time,
I used to go Cloud Shakers, so we have security. But they're like volunteer security. Right? It's not like just like bigger guys.
I don't think we have that luxury yet.
Everywhere need to, then you can't be older. This is it.
No, sorry, I mean as a security.
Obviously we're not I'm not trying to put worst case scenario, but then
yes, of course.
that would be pretty, if you are facilitating, imagine if I need help, no one's here, or the closest person can close it, at home somewhere, and then what's going to happen?
I think if you ever feel really unsafe, like call the police. So that's, we have issues sometimes with evening service because it is a lot more open where people upstairs, on the street. So people come in. If they are disruptive, depends on what sort of disruptive they are, but we usually just get alongside them. Now's not the time to be doing that. Like, do you want to come out and chat, or we kind of just stay around the same area. If things do escalate, then we have called the police before, or we have said, there's this situation. We often say, there's women and children here, so we feel like this person could be a threat to that. If you can come as soon as possible, and so that's how.
So has that usually been
It's usually,
in the worst case, if that's
if
happened,
you mention that there are women and children, then they'll come quicker. So that happens.
So they're carrying off facilitators.
psychiatric unit like St. Vincent Hospital, yeah, there is always code. If the aggression is a verbal code. Yeah, immediately they will come. Yeah, and then they will help us with they will either take them to the TRIA because on the acute ward is, as I said, acute ward we know the patient so well. All the IMI is already there, PRN, it's different. Yeah, but even in the community, 24-hour rotation, night time is only skeletal
Just
staff.
if something happens, then just make sure you write it down and report it.
Yeah.
Cool. So as you can see, yeah, there's a lot of different responses, and it really does depend on that situation. But as best as possible, we'll get participants to register beforehand, so we have a little bit of information about them. So that's the aim. Cool. So we'll have one more. We'll just run through quickly because it's almost 3. So during a small group, one member calls out and states, so how's this fair that everyone can share anything on their mind? Some of these stories are really triggering to me. So, this is, again, a little, kind of happened in the context of an addictive recovery session. So people were sharing about their journey to recovery. And in this context, it was an alcoholic recovery. And of course, someone mentioned before, everybody's on different stages of recovery. So when some person's saying, "Well, I just had a drink last night," but then one person, their recovery looks different because they want pure abstinence. So hearing one, the person next to them say, "Oh, I had a drink," might, can trigger them because they're already, gone a whole week without. So in this context, something could happen. Like this could happen. So, if this does happen, and it might not be an addiction thing. It could be anything really. But it could be addicted to computer games. But that is also a real issue. Yeah. So how what sort of things would you do in this scenario?
I think I would kind of acknowledge that, in this case, that I understand my thoughts. It's not uncomfortable and it's triggering. It can be triggering for you. Then try it. I guess it also depends on the group.
Facilitator. This one talking about this alcohol or something, and I say this story is very triggering to me. I would maybe say that I haven't drunk for so long. I get this fear. Yeah, you as a facilitator, you would what would you
I don't know. I'm just trying to.
You said to me, you will just help to say you can understand that. Is it? You want to say that? I can understand.
Yeah. No, I can understand how it can be triggered.
Yeah. Okay, how can be triggered? Yeah. Must be difficult to go through.
Just because I think
whenever someone tells us, you also good. When you say must be triggering to you tell me. That is also good. Another way of saying it is that it must be because theoretically there was doing all this counseling, mental health, and talking to anyone. Sometimes we, as case manager, we talk to them one by one, one to one. Like that means that this is it. Actually, you don't understand me. Because I have been bullied by my husband for so long. All our story is different. Something like that. Yeah. Even if you are, you never know because I'm a that kind of person. It must be yes. It is triggered in a group. Is better in a group. In this group. Because he says something and then I said, and all this. Especially in Chinese women. Our culture don't allow me to drink.
That's what you say understand. You don't understand.
That's it. That's why you say don't say that. In theory, I learned it in the theory wise is that even some, in teaching, some of the lecturers still giving them that. I understand what you feel.
But no, exactly.
You would say like, I understand this is a difficult situation.
That's it. It must be difficult because see, a youngest generation may say, I lost a boyfriend. And I failed my exam, I couldn't get in. It is very frustrating. They get anxious and depressed.
I get that.
No, it's good we share.
Because that could be a tricky thing, but just to acknowledge that it's difficult for them. Then I guess trying to work through like the context of the group, because if the group discussions about like alcohol,
Yes, they
others
have
might
both.
want to
Yeah.
share about their experience.
Yeah.
Then I think that's kind of up to
Yeah.
you can talk to Sarah over there.
Are you thinking of the AA group or is it in the AA?
It's not
You can talk to one
No,
of
this-
us.
This
It's a
example,
general.
yes, yeah. But maybe like if we have a month where it's focused on addiction, that would
Yeah.
look different to everybody. So
Yeah.
But addiction, I think in this kind of context, in church context, I think we need to be really careful because, as we said, we don't know which stages they go through.
yeah.
That motivational counseling, the motivational interviewing, because it's good that we give people, even in depression or whatever, when they are ready, they change.
Yeah. That's why. Yeah, we'll start off with more like
Yeah.
not low key, but like just like loneliness is very.
That's it. That's a very
It's not
good
like a
one.
mental health
Yes,
topic. It's
yeah.
quite open to everybody.
Yeah.
So
Yeah.
we'll start off with that, and then
Yeah.
we might. This is like a very, I guess, heightened example, but it's good to just discuss it and be aware that things like this can happen. Yeah, even in a church context.
Yeah.
Well, I was wondering, like, it depends on, the second step is like trying to identify what kind of things are triggering for that person. So just trying to say, okay, well, which part of it was triggering for you? If it's alcohol, and then perhaps if the group, see if the group's kind of open to talk about alcohol without that. But if it's too difficult, it might, because some cases would be like, if everything's too triggering for them, then it might not be, that might not be an option, but you can't, I guess you can't make this, propose the next step if you don't know what's triggering for them. And then, so once you fully understand what's triggering them, then I think you can perhaps decide whether to separate them and maybe one facilitator to them. Or, if they're okay, like if it's only one topic, then you ask the group to steer away from that topic. But like still talk about their journey and something like that. If you know these topics, then that are coming up in like that they can take those then I might start off the session by saying, where is everyone? Maybe just establish the baseline. If this person's abstinent and this person's like just started, then this person's like just having one drink every month or something.
Yes.
Then I would probably just be like, maybe just like understand that. Find out these people on different journeys, so maybe when we share, like, just keep that in mind because maybe if you say I had a drink today, that's really trigger something to relapse.
Yeah. And that's a really good point.
Yeah. But I don't know how to kind of do that.
just say what you just said, like at the start. You can be like, I just want to let everybody know that everybody is on a different journey, personal journey. So we just have to be mindful that things that somebody says might not be relevant in your situation, but just be accepting that we're all on different journeys. And if something is triggering you, you might want to step outside for a little bit, take a bit of fresh air, and then come back in when you're ready. Like even something like that at the start of each thing.
Yeah, and then when they go out, they don't want to come back.
That's
it.
Yeah.
Yeah, just like even loneliness.
Yeah.
Loneliness is like,
Exactly.
I know that I can participate because I never felt lonely. But
Somebody.
I feel disconnected after my sometime last year.
Yeah. So just in the interest of time, I might have to wrap it up. But thank you so much for all your discussions. That's really, as you can see, there's no sort of one right way to do something, and it's all dependent on what happens on that day. But I think God will help us.
They say we need to pray before we start.
Yeah. So just quickly, next steps. So today we've had the training session. Our next support group, our very first one, will be on the 14th of April, and that will be in Price Hall. And the topic will be loneliness. Thereafter, we'll be at 277, and it starts at 12:30 each time.
Where is it? Sorry, where is it?
So just for loneliness, it'll be Price Hall opposite. Yeah. And then it'll be the first Sunday of every month thereafter at 277, which is across the road. You go upstairs. Are you all aware, or where 277?
No, like across, there's a shop called Paddo, a Korean shop, and then over to the left, there's stairs that go up.
You go up.
But will you be there for the first session?
Yeah, I will be there. Yeah.
You can just stay. We have to do something there.
Yes.
Keeping an eye on.
Yeah.
So it's 2000 Little Ones School.
Yeah. Just literally opposite here, and a red door. Yeah.
Maybe building.
Yeah.
Oh, those are the good topics. Yeah, that's all right.
Yeah, so we'll-
anxiety and depression.
So these are some potential topics, but yeah, during your groups, please let the participants know that they are welcome to add suggestions and to email the Caring Together team. And we'll have 2 facilitators each session. And yeah, over the next couple of weeks, I'll send out a roster, and if you guys can fill it out and put maybe topics that you might want to be interested in leading as well, that will be great. But yeah, I'll do that during the next 2 weeks, I think. And finally, yeah, so this is the QR code for participants to sign up if they want to join. So if you want to, you know, take a photo of this and just send it to friends or family, that will be great. And we will promote this at church over the next month. So hopefully we'll get more traction. And I think, is that it? Yeah.
I think most of us should be here, don't you think? We want to be facilitator. And yeah, sort of in a way we are also like participants, right? Yeah, you never know how many will turn up, like the loneliness or the depression. You know,
Yeah.
Yeah, that's good.
Yeah. So thank you to everybody for attending today. Yeah, it was really wonderful to have you all on board. I really appreciate that. Just a quick note, if you can help out with the cleaning as well, that will be wonderful. Just do what you can. And I will quickly end in a prayer. Yeah. Dear Heavenly Father, thank you so much for this afternoon that we had together, and I just want to thank you so much for these volunteers who have come and put up their time to serve the people in the church via the support groups. I really pray that you really equip us with your love and your knowledge and your compassion, and that we can live that out as we help facilitate support groups. I pray you'll guide us, and you'll really use this time to really reach and touch the hearts of people in our church community to feel loved and heard and experience your love, Lord. And pray you'll help us all through this journey, and thank you so much for all these people here today. In Jesus' name, amen. Cool. Thank you, everybody.
Is